about the review of CBT treatment in military personnel with PTSD, TBI, and sleep disturbance. This is a presentation by Gina Mersonia, Ellie Collins, and Ashanti Lewis with faculty advisor Dr. Schoon. Within the military population, the prevalence of post-traumatic stress disorder, insomnia, and traumatic brain injury are particularly high due to combat environments. Experiences of insomnia are increased following TBI in combination with PTSD. It is imperative to outline effective and ineffective modalities of treating the symptomology associated with the pathologies. CBT has been one of the gold standard interventions in the treatment of PTSD in addition to TBI and insomnia due to its efficacy in decreasing negative symptoms. Some gaps in the literature exist surrounding the most effective methods for this population and the variety of methods available, including CBT, CBTI, CBT with smartphone applications, and internet-guided CBT. To successfully support this population, these deficits must be addressed.
Several studies were reviewed with service members using keywords like CBT, PTSD, insomnia, and TBI across various web-based databases like PsycInfo, Google Scholar, and PubMed. We selected 11 articles between the years of 2011 and 2024 based upon their relevance to the overall topic of CBT use in PTSD, as well as TBI and insomnia, in addition to the psychometric values associated with each article. Results from the articles were reviewed for their intervention efficacies and treatment outcomes, in addition to some of the study limitations. And the studies each examined PTSD, insomnia, and TBI, ranging from moderate to severe presentations amongst veterans and active duty participants. In some of the studies, they measured the effectiveness of each modality over a 6-week period of time. And the results were integrated to create a model of effective treatments and future implications for CBT use. For the results, we found that various adaptations of the CBT treatments and modalities were shown to be effective in treating PTSD, TBI, and sleep disturbances. And CBTI, in conjunction with the use of a CBTI coach app in one of the studies, was shown to be effective in the treatment of TBI with insomnia in this U.S. military sample. They also found that both sleep medication usage decreased, insomnia severity decreased by the end of the 6-week period before the effects started to plateau.
We also found that there was a 23 to 28% reduction of sleep symptoms observed in a sample, with the majority of the change happening at 6-month assessment, and that we also saw that internet-guided CBTI has been shown to be moderately effective in the treatment of self-reported insomnia and depressive symptoms in military and veterans with a history of TBI. Overall, this research of CBTI has shown medium to large effects in reducing the symptoms of insomnia in comparison to placebo control groups and is at least as effective as pharmacological treatments. Despite the growing literature, there is limited empirical studies on exact treatments and their success rates for the military and veterans who have PTSD, TBI, and sleep disturbance. These sleep disturbances have a negative effect on the outcomes of individuals who have PTSD and TBI, as well as the overall treatment of their PTSD and TBI. There's been a positive research of psychological treatments for the sleep disturbance in military and veteran populations, especially in those who are suffering with PTSD and TBI. Pharmacological intervention has been the go-to treatment of sleep disturbance within this population, but this itself has negative impacts when given to individuals with TBI and PTSD. Ultimately, CBT and CBTI can be useful in mending some of the psychological wounds incurred in service, but there needs to be more effective interventions decided in order to be better support the military and veteran populations. This lack of research, in addition to the rise of new treatments, can allow for better outcomes for military and veterans. And due to the limited studies, future research should seek to evaluate more effective treatments and more holistic approaches to treatment outside of pharmacological interventions.